right to left on the sides, coronal suture, and the middle sagittal suture. Coronal suture, sagittal suture, the orbits, the nasal cavity, foramen magnum, zygoma, temporal fossa. Okay? This related to the head and neck. My next would be the vertebra. The vertebra. Yes. You got what to? Don't record. Just write down. Okay. So this would be, you see, the first cervical vertebra. The first cervical vertebra. Okay. And identification of this first cervical vertebra is it doesn't have any body. It don't have any body. For example, you see another vertebra. This vertebra has got a body. You see, this is the body of the vertebra. But in case of cervical vertebra, there is no body. The axis, second vertebra, this knob that goes inside. You see? Fill the gap. So this is second vertebra, and this is first cervical vertebra. Okay? First cervical vertebra, that is called atlas. It has no body. The second vertebra, it has got a process, this colored black. This is called odontoid process. Odontoid process. This is having a beak, a process up. O-D-O-N-T-O-I-D, odontoid process. So this is a vertebra with a process is called axis or second vertebra. A vertebra with no body, like a ring, you see, this is called first cervical vertebra. The bone here, this is the bone related to the shoulder. Okay? Your shoulder, back of the shoulder, the bone is there, and it has got processes. This process is called acromion process. Acromion process. This finger-like process is called coracoid process. Coracoid process. This is called glenoid cavity. Glenoid cavity. And here, from here to here, this is called spine. What is it called? Spine. This is called the spine of the scapula. Or you may call it spine. So this is called the spine. Okay? What is it called? Spine. S-P-I-N-E. Spine. This is scapula. Okay? This is mandible. Okay? Mandible has Then got this process called coronoid process. Coronoid process, and this is head of the mandible. The head of the mandible. This is coronoid process. This is head of mandible. This is pelvis. This is called ilium, fan-shaped ilium. This is called pubis. This is called ischium. Three bones: ilium, pubis, ischium. Okay? Ilium, I-L-I-U-M, pubis, P-U-B-I-S, ischium. Now, this is heart. Okay? It has got a base. This is the base of the heart. And this is the apex of the heart. What is it? Apex of the heart. Apex of the heart. So this is heart. And here, these are the cavities, ventricles. This is the left ventricle, this is right ventricle. The left ventricle, right ventricle, this is apex of the heart. And here there are a few blood vessels coming out. The red colored blood vessel is starting from the ascending aorta. This is ascending aorta. Then comes the arch of aorta. Okay? Arch, A-R-C-H. Starting from ascending aorta. Then arch of aorta. And descending would be down. This blue colored vessel is called pulmonary trunk. Pulmonary trunk. This is blue colored, another vessel is called superior vena cava. This one. Okay? Superior vena cava, ascending aorta, arch of aorta, pulmonary trunk, base of the heart. Red is aorta. Blue is pulmonary trunk. Okay? Blue is pulmonary trunk and red is aorta. Okay? Now this one is superior vena cava. This is apex. What is this? Apex. Apex of the heart. And this is the base of the heart. 4 pulmonary veins present in it. 4 pulmonary veins present in it. Okay? Base. B-A-S-E, base. Because you see, heart is lying on the diaphragm like this. So this is base and this is apex. Okay? Right? And inside would be the cavity of the right atrium. The right atrium. And there is a white paper inside valve which is called right atrioventricular valve. Between atrium and the ventricle, this is called atrioventricular valve. And these are the coronary blood vessels. sure is colon. Very nice. Okay. What is this? Very nice. What is this? Good. What is this? Small intestine. Okay. What is this? Appendix. What this white line is called? Tinea coli. Tinea coli. Tinea. T-A-E-N-E-A. T-A-E-N-E-A. Tinea coli. C-O-L-I. Okay? This is greater omentum. You see fat is there inside, greater omentum. What is this structure? Pancreas, very nice. What is this structure? Good. Spleen is not duodenum. Duodenum. Okay? What is this specimen? Liver. Liver has got how many lobes? 4. Very nice. 4. What are those? Yes. Good. Quadrate and caudate. C would be, when you write down A, B, C, D from top, C would be on top and Q would be on below, bottom. So when you pick up the liver in an anatomical position, this lobe is, which is closer to the blue vessel, is called caudate lobe. Caudate. C-A-U-D-A-T-E. Caudate. Caudate lobe. And this lobe is quadrate. Quadrate. Q-U-A-D-R-A-T-E. Quadrate lobe. Okay? And this is definitely, big lobe is right lobe, small lobe is left lobe. This is inferior vena cava. Inferior vena cava. IVC. Correct. Okay? IVC, just write down IVC. Finish. What is this? Gallbladder. Gallbladder end up in a duct which is called? No. Cystic duct. This gallbladder ends up in cystic duct. And here the two ducts, one from the left lobe, one from the right lobe, you can see these two, very small. They unite to form, with the cystic, to form common hepatic duct. So this is like English letter Y. You see? One for the right lobe and the other for the left lobe. They unite and again unite with the cystic duct to form the common hepatic duct. Can you give me ballpoint? Anybody? Ballpoint. You see? This is, what is this? Gallbladder. What is this? Cystic duct. Okay. What is this? Hepatic duct. Right and left. Okay, this is right, this is left. The green one? The green one. The green one is the hepatic duct. The green one is cystic duct. And the green one is gallbladder. Okay? The red is hepatic artery. The purple is portal vein. Okay? Portal vein. P Portal, portal vein. So this is called gallbladder, cystic duct, right and left hepatic duct, common hepatic artery, and hepatic duct, hepatic artery, portal vein. This is inferior vena cava. This is closer to inferior vena cava, is caudate, CAUD. And this is quadrangular, 4 angles, 1, 2, 3, and 4. Quadrate, QUADRATE, quadrate. Look. Come to this specimen. What is this? Urine bladder. What is this? Prostate. What is this? Prostatic urethra. Okay. What is this? Bulb of penis. Okay. What is this? Urethra. Penile urethra. Penile. The urethra in the penis is called penile urethra. Okay. Okay. Right for that. You said bulb of what? Bulb of penis. Bulb of penis. This one. What's BULB? Okay. Now what is this? Spermatic cord. Spermatic cord. Okay? Yes. What is this? Testes. Okay. What is this? No. Ureter. Because ureter, when you put it in this position, normal position, you see, this is the normal position. So when you turn around, this is coming from above. This is called ureter. Okay? And this is called ductus deferens, vas deferens. Okay? This is called vas deferens. Vas deferens. You see, the vas deferens is coming out from the spermatic cord and go like this. Okay? To enter in the back of the urinary bladder with seminal vesicle to enter into it. Okay? So this would be, and this small duct inside would be ejaculatory duct. Okay? Ejaculatory duct. This one. This is small duct. Yeah. And let me show you one thing regarding the male system. What is this? Epididymis. 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 Okay? What is this? Epididymis. What is this? Testes. Okay? Same system. Now regarding the female urinary system. What is this? Uterus. What is this? Fundus of uterus. This is body of uterus. That is cervix. This leads to vagina. fallopian tube, which is pink in color, red in color. Fallopian tube or uterine tube in this specimen is red in color. But the ovarian ligament is yellow in color, like ovary. Color of ovary and ovarian ligament same color, yellow. The pink color is uterine tube or fallopian tube. This is uterine tube or fallopian tube, red color. Yellow color, this is ovarian ligament. Okay?
What's the yellow?
Ovarian ligament is of yellow color. Same specimen. Again, this specimen. This is urinary bladder on top, above, uterus below, and these are the two yellow colored ovaries, 1, 2. Got it?
Yes.
These are two fallopian tubes. And pink color, this fallopian tube is like this. You see it? And the ovary attached to ovarian ligament. Okay? See, this is ovary, yellow color. This is fallopian tube, red color. And this fallopian tube is up to here. Okay? This is ovary, this is ovarian ligament. Okay? This is uterus, and this is urinary bladder. Tell me, what is this? What is this? I told you, ureter ends in letter R, and kidney is also called renal.
Yes.
R and R. One is ending, one is beginning. So that is on the top, above. So that is called ureter,
Yes.
not urethra. Urethra is single, one. In the middle, like penile urethra, female urethra, in the center. But you see the ureters are two in number. Okay? We can say ureters. Ureters. You can understand. Ureters means two. Not we say urethras. Can anybody say urethras? No. Ureter 2 and urethra 1 in the same group. This is, you see, this is the fimbriya of the fallopian tube. Fimbriya of the fallopian tube. Okay? Same specimen. Let me show you, what is this? Urinary bladder. What is this? Uterus. Yeah. This is uterus. This is uterus and this is urinary bladder. Okay? And to that, yeah. Above is, you see, this is going on the back, you can see here, this is going ending up to the vagina. Okay? This is uterus, having collapsed cavity, compressed cavity. But here the cavity is roaming, you see, because every time urine is there. Little amount here. So this is urinary bladder, ending up into urethra. This is urethra. And this is vagina. Okay? What is this? This is ovary. Fallopian tube. Okay? slow because it's very limited time. In 1 hour, I have to take only half an hour. In half an hour, whether it would be good for you, I don't know. Wallah. Or it is bad for you. Inshallah also. Inshallah also, it would be good for you. So, now the male reproductive system, you see, these are the two testes, 1 and 2. What are these? Epididymis. Any query? Sure? Epididymis. What is this? Spermatic cord. Spermatic cord. In this spermatic, S-P-E-R-M-A-T-I-C, spermatic cord. Yeah.
What's the difference and sperm cord?
What is that?
Ductus difference and sperm.
Ductus difference is something which is related to the epididymis. You see the head of the epididymis, body, the area of the epididymis, that ends up in ductus difference, which goes through spermatic cord. A spermatic cord is the collection of some certain things. What are those? Ductus difference, number 1. Number 2, testicular artery, campaniform plexus, the crematic muscle, the legs of the testes. All of them, they correspond to the spermatic cord. It's a mixture of so many things. But ductus deferens is a single tube. That is the tube through which the sperm passes. The sperm passes through it. I will show you in this diagram, in this model. Just see. This is, you see, testes inside, and the whole, all of it, blue, red, white, all, is called spermatic cord. But when I become closer to this camera, this white thing, white tube inside, is called ductus deferens. Do you follow me? This is ductus deferens. This yellow colored structure. This is ductus deferens. And these are the venous plexus, artery, and all others. And the ductus deferens inside, that go inside the inguinal ring, and you see here it passes and comes here. Got the idea?
Yes.
Just have a look again. This ductus deferens is starting from here, going up with the spermatic cord, enters through the superficial inguinal ring, then there is inguinal passage, and definitely ring inside, deep inguinal ring, and here exactly they enter inside their tongue. Yeah, this one. You see? This is ductus deferens. Okay? So this is related to this structure. Now, let's see what is this. What is this? Aorta?
No.
Femoral would be below inguinal ligament. This is in the abdominal cavity. And if you see, this is the sagittal section, not in the midline. This vessel is not present in the center. Aorta is present in the center, or closer to the center. But this vessel is not present in the center. This is away from it. This is called common iliac artery. What is it called? Common iliac artery. And after the common iliac artery, here one goes to external iliac and the other internal. Okay? External goes and crosses the inguinal ligament to become femoral artery. Like in this view. In this view, you can say, you can see here, this red colored, can you see it? This one? This which is cut. Okay? This is called, what is it called? External iliac, and common iliac would be little above. And here from the common iliac, the external iliac, which becomes femoral artery, and the other branch goes inside the pelvis, that is internal iliac. So, in this diagram, in this model, I can give you better view. Just have a look. Can you see it? This is called common iliac, and that goes to the inguinal ligament. It becomes external iliac, and this is internal iliac. Okay? Common iliac, external iliac, internal iliac artery, and then becomes the femoral artery. When it crosses the bridge of inguinal ligament, it becomes the femoral artery. Okay? Now related to this specimen, I cannot, yes. For you people, I'll show you here directly. What is this big vessel? What is this vessel? Common iliac. Then it divides into two: external, internal. Right? What is this? Interior network. It divides into two common iliac veins. Okay? Again the same. Common external iliac vein, internal iliac. Okay. What is this? Ascending aorta. Okay? And here on the right side, this is becoming brachiocephalic artery. There are three arteries, major arteries coming out from the arch of aorta. What are those? On the right side, one, brachiocephalic, and the left side, two. Left common carotid and left subclavian. To remember, left common carotid, which is this one, and left subclavian here. So, from the aorta, right side, one big vessel is arising, that is called brachiocephalic trunk on the right side, which soon divides into two. One is going to the neck and to the brain and the head, which is called common carotid, and one is going to the upper limb, which is subclavian. What is the left side? What happens? The two separately starts their course from the aorta. They start separately. Left common carotid and left subclavian. No brachiocephalic. Okay? Now with this, what is this structure called? White line. Ureter. Ureter. For ureter, I have to show you see, this is ascending aorta and this is arch of aorta. Right side, one big trunk is there. This is called brachiocephalic trunk, which divides into two. right common carotid, right subclavian. But on the left side, they are, yeah. Okay, I'm just finishing.
Oh,
Okay. On the left side, it will be left common carotid going towards head and neck, and left subclavian they arise separately from the artery carotid. Isn't it? So this would be the case diagram. What is this? The red colored is aorta. The blue is inferior vena cava. What is this white line, white tube? Okay? What is this? No, urinary bladder. This is uterus. Which is connected with the fallopian tube. This one or this one? This one is fallopian tube, ending up into the femur. You see? You can hold it in the hands. You can make it sure. Yes, you can hold it. See, this is expanding into infundibulum and then the femur. And here the ovaries. This would be the ovarian ligament. Okay? The first vertebra is called the actus. Actus. A-T-L-A-S. And the second vertebra is called axis. Actus has no body. Axis is giving its process and acts like its body. So, and it's 7 cervical vertebra, 12 thoracic vertebra, lumbar 5 which are fixed, and then sacrum 5 and coccyx. Okay? Yeah. The humerus, the head of the humerus, the neck up to the neck which is surrounding the head is called the inguinal neck. And the neck which is lying below the tubercles is called cervical. This is shaft.
What is surgical neck?
Surgical neck is below the tubercles. It is the upper expanded part of the shaft. Okay? This one. And here the shaft, and then it is the lower end. The radius is, you see, here on the lateral side we have got radius smaller bone as compared to the other, which is on the medial side, which has got process. And it is called ulna. Radio ulna and the carpal and the carpal bones, all that. Dr. Ayman? Please come. Give me the specimens.